So we are gonna take a deep dive into option number one here, and that is Original Medicare with a Medicare supplement. And again, this is going to be the #1 way to receive your healthcare when it comes to Medicare. So if I'm just highlighting the major exposures, remember, if I just had Part A and just Part B and no other insurance, I'm gonna have a major hospital deductible. My skilled nursing coverage is very, very limited. A lot of out-of-pocket expenses with that. Additional co-pays for longer hospital stays. And then Part B, the biggest exposure. Remember, I have a 20% co-insurance with no limit and a 15% Part B excess charge. So again, if I'm identifying here, I have my Medicare card, then I'm going to have my Medicare Supplement card, and that's really what we're gonna focus on. And then my third card would be my prescription drug plan, which we're gonna talk about that in more detail here in a minute. But if I really had to simplify what a Medicare supplement does, is it is a secondary supplemental insurance with a private company that is going to cover up those major expenses that we just talked about, your 20% co-insurance and that large hospital deductible. And we're gonna really take a deep dive on what a Medicare supplement is, what are the options when it comes to that, maybe what the cost is. So again, it's a private insurance company. Now, when I say private insurance company, they have nothing to do with prior authorizations or networks or anything like that. Medicare is your primary insurance. If your doctors accept Medicare, they will accept your supplement. It does not matter the company, okay? This chart, page 76, this is from that Medicare and You handbook we were just talking about. This really helps you identify the different kinds of Medicare supplement or Medigap plans that are available out there. Really, we're gonna focus on 3 different plans here. So if you see here, Plan F used to be the most popular plan that you could get. Anybody new to Medicare after 2020 can no longer purchase a Plan F or any plan that covers your Part B deductible. So the 2 that we're really gonna focus on is Plan G and Plan N over here on the right. Plan G is going to be the most comprehensive coverage that you can have. And you can see here, it's 100% of everything except for that Part B deductible. And again, here in 2026, that is a $283 deductible. And once you reach that with a Plan G, all of your other Medicare approved expenses are going to be covered. So it's a very comprehensive plan. Plan N is very, very popular right now. You can see it's 100% for everything. But you do have that Part B deductible still, the $283. And then there's what's called Part B excess charges. Remember, we talked about that a little bit ago. Super, super rare. It's an additional 15% of your 20%. Less than 4% of providers charge that here in the country. And you can see some stars or some asterisks here by the Medicare Part B co-insurance, and we're gonna talk about that here in a minute. Okay, I wanna highlight this skilled nursing portion again. So if I go back on this chart, you can see skilled nursing under Plan G and Plan N is covered at 100%. And there's a common misconception with this, that means your Medicare supplement would cover any kind of skilled nursing coverage. And what that really means is that they will cover days 21 through 100, the 217, at 100%, but you are still responsible for all costs after day 100. There is still no coverage for assisted living. There's no coverage for custodial care. So it's super important to be aware of that. Okay, so what is the cost of a Plan G? Again, this really, really depends on your zip code and your state. If you're really curious, these vary so much by state. If you want to see what the cost looks like in your area, go ahead and click that link for your one-on-one consultation. But the average cost, it could be as low as $100 in some states. The average, it goes up to about $200, and some states could be more of a higher premium than that. It really depends on where you're located for that. So which Medicare supplement is going to be the best for you? So again, we really talked about the Plan G and the Plan N. And if you just look here, this is the side-by-side comparison for that. Remember, with Plan G, all you're responsible for is that annual deductible of $283, and then all other Medicare approved expenses are covered. With Plan N, the biggest thing is it's gonna be a little bit less premium for this. Really, depending on the state, it could be anywhere from $30 to $75 less of a lower premium than a Plan G. You have the exact same deductible, the $283, and then those asterisks we saw on that page 76 a few slides ago. What that means is You could have a copay of up to $20 for any doctor's visit. You could have a copay of up to $50 for an emergency room visit. And then you have that super rare Part B excess charge that you would be responsible for. So those are the big differences. Both are very, very good options, and we can find out which is going to be the best for you. Okay. So enrollment periods with Medicare supplements. This is the biggest thing that you need to know when it comes to this is you can actually enroll and sign up for a Medicare supplement 6 months before your birth month or 6 months before your Medicare effective date. And this is the best time to do that because the rates do change constantly throughout the year. They can increase throughout the year. So the earlier you get that locked in, you actually lock in that premium for 12 months from your effective date. So super important to get ahead of that as soon as you can. Helps you avoid any mistakes and just get it off that checklist that you have. Huge thing to be aware of. These are federally standardized plans. So really what that means is a Plan G from one company is the exact same Plan G from any other company out there. They are all the exact same. The coverage is the same. And remember, they have no networks for that. So biggest thing to be aware of is they are federally standardized. Okay? This is just a list of some of the Medicare supplement companies that we offer here at Greening Health and Wealth. You're gonna see some names on here that you recognize. You may see some names that you don't recognize. We offer a lot more than this, but you see Aetna, Mutual of Omaha, Cigna, United Healthcare, just to name a few, but we offer, no matter which area you're in, we're gonna have some companies that we offer for that. So we always have a plan that's gonna be good for you. I always like to go through a few different myths about working with insurance brokers. So transparency is one of my favorite things. We are insurance brokers, and the first myth is that you have to pay us a fee to work with us, and that is absolutely not the case. And if someone is charging you a fee for help with your Medicare insurance, you should absolutely run for the hills for that. Myth number 2 is nobody works for free, so the insurance company must charge you a higher price if you go through insurance brokers like us. And again, that is not the case. You can get and will get the exact same price going through us as you would going through the insurance company directly. And myth number 3 is that if we get paid by the insurance companies, we must have a bias towards one company or the other. And again, this is not the case. All the insurance companies pay us the exact same. And really how we look at it is our job is to educate you, answer any questions that you have, look at both options and really help you find what's going to be the best for your unique situation. Okay, so again, breaking that down again, we charge no fees. You're going to get the exact same price through us as you would through an insurance company. And then we have multiple companies to choose from. They pay us the exact same. So we can always help find what's going to be the best for you. Okay, very good. Now let's talk about prescription drug coverage. So prescription drug coverage is, in my opinion, it's going to be the #1 thing that can be complicated. And I have no idea how you would be able to do this on your own or how seniors are expected to do this on your own. So if you take a few prescriptions, or even if you don't take any prescriptions, super important to click that link and get your one-on-one consultation with someone on our team to find out what's gonna be the best plan for you and really how to avoid any penalties. So this is the #1 way that you can rack up penalties with prescription drug coverage. And the biggest thing with drug plans that not a lot of people realize when it comes to Medicare is no matter what, you are going to get your coverage through a private insurance company. So this is not through Medicare. This is through a private insurance company. And so you're gonna have things like prior authorizations, formularies that you have to deal with. And you can't get around that with Medicare, unfortunately. So it's super important to have a good resource that knows the prescription drug plans, knows the formularies, knows the processes for formulary exceptions to make sure that you are covered the correct way. Okay, biggest thing. So again, penalties, Part D late enrollment penalties. So you have a 1% penalty for every month that you should have had drug coverage, but you did not. So 1% of the national average cost of a drug plan, it tends to come out to a little over $4 every 12-month span that you have, and then you pay that every month for the rest of your life. okay? And that penalty would start 63 days after your Medicare enrollment date. I always like to touch on our process for Part D. We input your prescription list onto Medicare's online calculator. This shows all of the plans available in your area, in your zip code. We choose your pharmacy, or you tell us your preferred pharmacies. We compare all of the options that are there, give you a cost breakdown by month and by year, and tell you exactly what you're gonna pay each month. And then we help you sign up with a plan of your choice. And then we do reevaluate this with you every single year. So drug plans specifically, they change so much, formularies change, prices change every single year. So we reevaluate this with all of our clients from October 15th through December 7th, okay? And again, just a quick recap, option 1, original Medicare. Look at these as your cards. I have my red, white, and blue Medicare card. Remember, that's gonna be about $202.90. Then you have your Medicare Supplement. So it depends on your zip code and if you go with Plan G or Plan N. And then you do have your prescription drug plan. Some premiums are as low as $0, but they do get increased, really dependent on the amount of prescriptions, the pharmacy, where you're located. Everything plays a huge factor in that. So option 1, just a quick recap of original Medicare with a Medicare supplement. Remember, think of these as your 3 different cards. You have your original Medicare red, white, and blue card. That is $202.90. Remember, higher income earners could have a higher premium for that. Then you have your Medicare supplement. Really depends if you go with Plan G, Plan N, and it depends on zip code and state. And then you have your prescription drug plan. These premiums do vary greatly. Some are as low as $0, but they can be higher. Really depends on the amount of prescriptions in the state that you're in. So if you take a few prescriptions, remember to click that one-on-one link and we can get you that information to you. And again, when it comes to your Medicare and your Medicare supplement, this is the umbrella coverages that our licensed agents, our team, can really help you identify which is going to be the best fit for you to really eliminate all of the different gaps in the exposures that Medicare and your Medicare supplement has. So that was option number 1. So we are going to take a deeper dive into option number 2, Medicare Advantage, and really how does it work? What are the pros? What are the cons of that? So the number one thing when we hear people that have struggled with Medicare Advantage in the past, oftentimes it's because there was certain things not disclosed and they didn't give you all the information that you needed. My job today is to give you the information that you need if you go this route to make a proper decision for yourself. The number one thing is it is a managed care plan. So what happens is a private insurance company, they come in and they combine your Part A, your Part B, and most often Part D. They mash it all together and they call this Part C. That private insurance company replaces your original Medicare. So what happens when I have a managed care plan? The number one thing is you're gonna have networks, you will have prior authorizations. At the very least, your Medicare Advantage plans have to have the same basic services of original Medicare Part A and Part B. Plans can be as low as $0 per month. Again, really depends on your area, what location you're in. But no matter what, you have to pay that $202.90. And remember, when I have this lower premium, I'm gonna have some higher out-of-pocket costs, things like co-pays, co-insurance, but I do have a maximum out-of-pocket. That's gonna be the most you can be billed in a calendar year. And that's why we never recommend Medicare Advantage without the umbrella coverage. And again, really what that's going to do is eliminate your higher out-of-pocket costs for things like hospital stays, surgeries, specific treatments, anything like that. So how do I go about choosing a Medicare Advantage plan? Well, the number one thing is your zip code is super important. So I always like to use this as an example. We're about 35 minutes west of Nashville here in Dixon, Tennessee. Our Medicare Advantage plans are totally different than if I were to go into Nashville. Those Medicare Advantage plans are so different because we have different zip codes, networks are different, benefits are different, premiums are different. So zip code is super important. Are your doctors, hospitals, are they in the network that you want to look at? Is it an HMO? Is it a PPO? Are my medications covered? Okay, HMOs, I said I was going to talk about this a little bit. HMOs are going to be a little bit more of a restrictive network where your doctors and hospitals have to be in that plan's network. PPOs are designed to give you a little bit more flexibility. If you do look at PPOs, this is a common misconception. A lot of people say if you have a PPO, you can go see any doctor that accepts original Medicare, and that is not true. You have to make sure that your doctor is going to bill the plan before you go out of the network. So super important to be aware of that. Again, our licensed agents, our team can help you identify what is going to be the best plan. They can help you check networks, make sure your doctors, hospitals are all going to be in the network. And remember, one of the best things with Medicare Advantage is they do include some additional benefits. This does vary by plan. So dental, vision, hearing are typically included, over-the-counter benefits, vitamins, minerals, first aid items, and then they do include some gym benefits. Things like silver sneakers is super popular. Now, if you hear what I'm saying, Medicare Advantage is really designed to be a proactive healthcare system for you. So they give you these additional benefits in hope that you use them, and then in turn you're healthier, spending less on your healthcare costs. So that is how the Medicare Advantage program is designed. And again, there's a lot of things that go into that in choosing what's going to be the best option for you. How and when to sign up for Medicare Advantage is a little bit different than with Medicare Supplements. Remember, supplements, I can sign up as early as 6 months beforehand. With Medicare Advantage, that's a little bit different. You do have 3 months before your birth month, the month of your birth month, and then you have up to 3 months after your birth month to choose a Medicare Advantage plan. That is going to be the most common. The other thing that's not pictured on here that we run into all of the time is if you're over 65, you delayed Medicare for the first time, then if you want to sign up for a Medicare Advantage, you have 3 months before your effective date and the month of your effective date, but you do not have the 3 months after your effective date. So it's super important to be aware of that. And if you need help getting everything signed up in a timely manner, that's exactly what we're trained to do and how to help you in the best possible way. And again, that link is below. You can go ahead and click that. The most common enrollment period here is the annual election period. That is the October 15th through December 7th. And again, we review this with you every single year. This is the time to change Medicare Advantage plans if you wanted to go from Medicare Supplement to a Medicare Advantage plan, or review your different prescription drug plan options. So that time of the year is super important. And again, we review that with all of our clients every single year. Again, let's do a quick recap side by side here. I like to make things as simple as possible for you. So Medicare Supplement, you are going to pay a higher premium, but you are going to have more comprehensive coverage, more flexibility, more freedom. Really, the one thing I always say is the one downside with Medicare Supplements is they're going to have a higher premium. So if you're okay with that, it's always a great option. Medicare Advantage, you're gonna have a lower monthly premium. You take on some networks, prior authorizations, you do get some additional benefits, but with that lower premium, you will take on some more exposure as far as copays and out-of-pocket expenses when it comes to that. Remember, no matter which plan that you have, whether it's a Medicare Supplement or a Medicare Advantage plan, all of those exposures that we talked about when it comes to cancer, heart attack, stroke, non-Medicare approved expenses, and skilled nursing, assisted living facilities, custodial care, home health care, all of those things are going to be very limited no matter which option you have. So it's super important that you look at that umbrella coverages there. And that again is designed to help eliminate those major costs no matter which plan you have. So here at Gruning Health and Wealth, we do obviously do a lot on the Medicare health insurance side of things, but we do have a designated team of professionals just for retirement and income planning. And it's super important that this time, as you transition into Medicare, the financial picture is also transitioning for you. So we have dealt with all sorts of different kinds of accounts here in the past. So 401ks, employee-sponsored plans, Roth IRAs, market-driven accounts, even CDs, checking, savings accounts. These are all things that we have worked with in the past. And everything that we deal with is going to be super important as you transition into this time of your life. And everything that we deal with is going to be 100% principal protected. So really what that means is you can win when the market wins, but you will not lose if the market loses. That's super important that you don't outlive your money. So that's why we like to do that. You have a bunch of different growth options available, whether it's fixed interest rates or tie it to something with a larger growth potential. And in this time of life, income options, withdrawal options, liquidity options, these are all super important as you transition into this period of retirement for you guys. So this wraps up phase one of our three-phase approach here at Greening Health and Wealth, and that is today's educational workshop. Again, a part of this, you can get your 64 plus book, what I mentioned earlier, co-author with our founder, Chase Gruening, 64 plus, your guide to Medicare and retirement. If you click that link below, you can get your free copy for that. Phase number two is to schedule your free consultation with one of our licensed professionals here. We get you some bonus items. So it's a personalized Medicare roadmap. This is a date and a timeline for your unique situation. We get you a cost summary. Really, hey, what does this option look like? What does it cost? What does this option look like? What does it cost? So tailored to your unique and specific situation. And then phase number three, this is the most important, is our lifetime support. We have a full staff client success team that is there for billing support, claim support, anything that you need. Our goal is for you to never have to contact an insurance company again. We have a full team designated just for you guys to do that. And again, you are going to get an annual review with your agent every single year, and we are here to make sure that you not only get the best option now, but you're staying in the best option for your entire life, and that's exactly what we're here for. Thank you so much for joining us today, spending about 30-35 minutes with us. If you found today helpful, please click the blue link below, schedule that one-on-one consultation, answer any questions that you guys may have, and we'll see you guys next time. Make sure to like this video, subscribe to the channel, and leave any Medicare questions you have in the comments below. And if you'd like more help understanding your options, we've included links in the description below to schedule a free one-on-one consultation with a Medicare specialist and get a free copy of our Medicare and Retirement Planning book, 64 plus. Both links are down below in the description. Thanks again for watching, and we'll see you in the next one.